Welcome to the Idea Exchange podcast. In today's episode, we are talking more about jaundice. I'm your host, Wes Pili, and our guest is
Vincent Chilemba.
Welcome.
Thank you.
What is jaundice?
Jaundice is a yellowish discoloration of the skin and scolor from high and conjugated bilirubin. So the person would present with yellowish skin and yellowish scolor. Scolor is the whitish part of the eye, so that part of the eye tends to turn yellow. And bilirubin is a metabolite of red blood cells. So when red blood cells, which is a component of the blood, they have lived for some time, they get broken down, and one of the products they produce is bilirubin. And of course, jaundice can happen in neonates, like newborns, and it's normal. It's not a pathological condition in most of the times in neonates.
What are the different types of jaundice?
Pathologically, jaundice can be classified into three groups, and these are groups based on the specific cause of the discoloration or the specific cause of buildup of bilirubin. So it can be prehepatic, hepatic, or post-hepatic. So prehepatic, these are conditions that cause overproduction of bilirubin. So this can be this is mostly excessive breakdown of red blood cells, and the type of bilirubin which is overproduced or which accumulates is unconjugated bilirubin. And conditions that tend to cause excessive breakdown of red blood cells are like hemolytic anemia, sickle cell disease, malaria, and transfusion reaction. Another type is hepatic, and these are conditions that affect bilirubin processing of the liver. So when the liver cannot process bilirubin, and the bilirubin that tends to be elevated is both unconjugated and conjugated. And these ones are conditions that can cause hepatic buildup of bilirubin are hepatitis, cirrhosis, alcoholic liver disease, and drug-induced liver injury or drug-induced liver failure. Another type is post-hepatic. So these are lesions that affect or that obstruct the flow of bilirubin from the liver to the intestines. So the type of bilirubin in this case is conjugated bilirubin because it has been processed by the liver, and the conditions that can cause buildup of conjugated bilirubin because of obstruction can be a gallstone, so breaking the pass of bile from the liver to the intestine, pancreatic cancer, and biliary strictures. Biliary strictures also broke the flow of bilirubin from the liver to the intestines.
What are primary causes of jaundice?
So as I have mentioned earlier, jaundice is basically the buildup of bilirubin. So the primary causes of buildup of bilirubin would be gallstones, pancreatic cancers, biliary strictures, can be hepatitis, cirrhosis, alcoholic liver disease, hemolytic anemia, sickle cell disease, malaria, and transfusion reactions.
How does jaundice impact the quality of life and overall health?
So jaundice affects the quality of life mostly through the psychosocial impact. As I've said, when someone is jaundiced, especially if they have light skin, a lighter skin tone, they tend to it tends to be so noticeable. Like you can clearly see that the person is turning yellow or is turning yellowish. So this can cause anxiety, can cause depression and loss of esteem, and they can also be made by negative perceptions, they can be made with stigma and misconceptions from the community because of the condition. And on overall health, jaundice is associated with fatigue, nausea, and vomiting, including all the signs and symptoms of the underlying condition. And these can affect the overall health, the overall physical health of the person. So this would definitely depend on the severity of the underlying condition. So when the condition is so serious, like maybe sickle cell anemia, they might be so fatigued, they might be so physically deteriorated. Yes, so those are the main impacts of jaundice on overall health and life in general. And the other impacts would depend on the specific cause of the jaundice.
What are the most common causes of jaundice in newborns?
So in newborns, they can be jaundiced, not because of a disease or a pathological condition. This is called physiological jaundice, and this can happen because their liver is not matured yet, and it tends to not process bilirubin as effective as an older person. And it can also happen due to breastfeeding. Uh, it can be due to some components in the breast milk that cannot be metabolized properly. But jaundice can also happen pathologically because of a disease process in neonates, and most of the times it's because of an infection and because of genetic metabolic disorders. So these are individuals that are born with a metabolic disorder that can present as jaundice and can also be due to biliary atresia. So this is the narrowing of the biliary tract. So this will affect release of bile from the liver to the intestine and can present as jaundice due to buildup of bilirubin.
How do liver disease contribute to jaundice?
So as I mentioned earlier on the types of jaundice, there is a type hepatic jaundice. This is jaundice caused by liver pathologies, and uh, this happens due to the disease process of a condition affecting the liver. So during the disease process, it can cause damage of the liver cells that can release bilirubin into the blood, or it can affect the processing of bilirubin by the liver. So if there is damage to the liver cells, there can be release of conjugated bilirubin, and if uh, there is impaired processing of bilirubin due to a disease process, there can be a buildup of unconjugated bilirubin, and this buildup will also present as jaundice.
How do environmental factors increase jaundice risk?
So jaundice can also be caused by environmental factors. So these factors would be factors that directly affect the liver and can be like toxins. So when someone is exposed to toxins which are metabolized in the liver, they can end up damaging the liver and causing jaundice. Other factors like infection or infectious agents, these are infections that will affect the liver. So these infections are like hepatitis, mostly hepatitis B and C, which cause chronic liver failure. So this can also damage the liver and uh, present as jaundice. Uh, on another environmental factor that affect jaundice is alcohol. As we all know that alcohol is metabolized by the liver, and it's said that alcohol damages the liver. So when the liver is damaged by alcohol or excessive alcohol abuse, and they cannot process bilirubin properly, it can cause buildup of bilirubin and present as jaundice as well.
What role do genetic disorder play in jaundice?
So some genetic disorders can cause jaundice or can present as jaundice. For example, Gilbert syndrome. So Gilbert syndrome is described as uh, insufficiency of some enzymes that are involved in metabolism, especially metabolism of jaundice, of jaundice, metabolism of bilirubin and other compounds in the liver. So there is an insufficiency. That means that there's some enzymes still present, just not enough. So typically, when a person has Gilbert syndrome, they might be normal. They might not. They might be able to process bilirubin properly until when they're under physical stress. For example, when they're fasting or they're ill. So at this point, they might present with jaundice because of the genetic condition. So some genetic conditions, yes, like Gilbert syndrome and other genetic conditions that directly affect the liver or affect the metabolism and production of red blood cells can cause jaundice and can present as jaundice.
Are there any lifestyle factors that can contribute to jaundice?
Yes, there are a lot, actually, a lot of lifestyle factors that do contribute to jaundice. And for example, alcohol consumption, nutrition, obesity, medication and toxin exposure, and sedentary life. So I will just quickly go through each and every one of those. To start with alcohol consumption. So alcohol is metabolized by the liver, and the metabolites of alcohol, they are toxic to the liver as well. So excessive alcohol consumption can cause damage to the liver and contribute to jaundice. Nutrition. Basically, everything we eat, every nutrient we get is processed by the liver, and some nutrients tend to build up in the liver. It's for example, fat. When there is build-up of fat along the body, it can also build up in the liver. So nutrition, this also does contribute to jaundice. Another thing is obesity. Obesity is also mostly because of the buildup of fat associated with obesity. So the buildup of fat can also build up in the liver, damaging the liver and causing jaundice. Medications and toxin exposure, uh, as similar to nutrition, medicine, drugs, and toxins are metabolized by the liver. And some drugs, some toxins, they produce metabolites that are toxic to the liver, that can damage the liver and present as jaundice. And lastly, sedentary life can affect metabolism. When someone is living a sedentary life, they might have their metabolic rates go down, and these reduced metabolic rates can affect also the liver and impact the metabolism of bilirubin and present as jaundice.
What are the early warning signs of jaundice?
So some of the signs that someone can present with at the clinic when they have jaundice are fatigue. So this is general weakness. An individual just feel weak and exhausted after doing even the slightest of activities. They can also present with nausea. They can present with vomiting, and classically, they can present with discoloration. It's mostly noticed in their hands. Most people will notice that their hands are getting yellow, and maybe they might come with that. But it's clearly observed in the eyes when the eyes have gone yellow. That's the most classical sign of jaundice.
How is jaundice diagnosed and what tests are used?
So jaundice is not really a diagnosis. It's a piece. What can I say? It's a sign, or it's It's just a symptom of another pathology happening, another disease happening. So for the diagnosis, you can identify that the patient is jaundiced, and you try to find out what is causing the jaundice. So that specific cause of the jaundice would be the diagnosis. But for the most part, this is done clinically. So you do a physical examination and you assess all the likely causes of the what can be the likely cause of the jaundice, and you narrow it down. You can also do some lab tests. Uh, this can be done to eliminate other conditions that can also cause discoloration. You can do tumor marker tests. So these are markers. These are tests that can be done on the blood to check for a tumor in the lung, no, in the liver specifically. You can also do liver function tests. So these are tests that can identify the extent of liver damage or identify if there is any liver damage at all. You can also do microbiology tests. So these tests would help to identify if there is an infection, like in the case of hepatitis.
What are the most effective treatment for jaundice?
So the most effective treatment would be addressing the underlying cause. So the treatment would be specific for the cause after being identified. So this can be treating the liver failure, can be treating hepatitis, or maybe removing the tumor, and maybe you can also do a transplant if the liver has been distressed so much. Uh, Other treatment options can be lifestyle modifications and phototherapy, especially in neonates. So phototherapy is used to break down the pigment, the yellow pigment, the bilirubin from the skin, and aid its release. So this is done only in children because children can have jaundice without any specific cause. So to aid the release of jaundice and relieve the symptoms associated with jaundice, uh, neonates can be put in a machine that breaks down the bilirubin from the skin and aid its release.
How does lifestyle modification impact jaundice management?
So some lifestyles can worsen jaundice, or can hinder improvement uh, of treatment, or can hinder effectiveness of treatment in patients with jaundice. For example, diet. So a balanced diet can help in management and can help reduce the symptoms. Being well hydrated can also help to reduce the symptoms, as hydration will aid the function of the kidneys. So when the kidneys are functioning optimally, they can eliminate the bilirubin from the system. And also avoiding toxins. So avoiding toxins can also can also reduce jaundice by reducing the impact of toxins on the liver. Other lifestyle modifications would be weight management and alcohol consumption, as our weight or weight gain and excessive alcohol has been shown to damage the liver and contribute to jaundice.
What role does hospitalization play in severe jaundice cases?
So hospitalization is when a patient is kept at the hospital for treatment. So it plays a role in management jaundice by providing more effective monitoring and treatment standards. So when a patient is hospitalized, they can be monitored 24/7, and they can be stabilized if any complications arise. And the treatment can be more effective because the compliance is better when the person is hospitalized. But most of the cases of jaundice are treated as outpatient cases, so the treatment is done at home and not in the hospitals.
What are the benefits and risks of alternative therapies?
So alternative therapies are other ways someone can manage jaundice, which is not medical. So they have their own benefits and risks as well. And just to give the most specific ones or the most common ones, they are accessible and cheap. So this is a benefit. Alternative therapies like herbal medicine, they are accessible and they are cheap. Someone can just be taught to find a specific plant which is readily available in nature and process it for treatment. And some people they trust natural or alternative remedies, and this can have an impact on the course of the disease because uh, when someone has a positive attitude towards a treatment, they tends to be more positive results as well. On the other side, the risk of alternative medicine is mostly lack of evidence. So there hasn't been a lot of studies studying these alternative remedies, and they are not understood so well. There seem to be no one who knows how specifically these particular drugs work. So because of that, they might be risky to individuals taking them. Another risk is proper lack of proper guidelines. So for the most part, these alternative medicine, these alternative therapies, they don't have a proper guideline. They don't have a proper dosage. They don't have any guideline on how the doses should be spread, or when the dose should be started, or when the dose should end. So this can cause build-up of unwanted materials in the liver, especially in patients with jaundice who might already have an affected liver.
All right. How can jaundice be prevented in newborns?
So for the most part, the type of jaundice that happens in newborns cannot be prevented, and it's not alarming. It's not a pathological condition, as I've already said earlier. So there isn't much effort to prevent it, as it doesn't seem to affect the baby. But in cases where it can be prevented, they can maybe improve feeding. So sometimes newborns can get jaundice because of insufficiency, like when they're not getting enough food. So it can be prevented by making sure that the baby is well fed, or in the cases where the jaundice has come about due to exposure to toxins, it can be prevented by reducing or eliminating the exposure to that particular toxin or drug.
What education materials or resources do you recommend for patients?
So for patients who want to understand or who want to learn more about jaundice, they can read uh, current researches, especially those done in Malawi, for more accurate data or more relatable data. They can also go through the Malawi standard care guidelines. So these are guidelines for different disease conditions, and you can find uh, um, treatment guidelines for jaundice and other conditions in the Malawi standard care guidelines.
How do you counsel patients on jaundice prevention and management?
So to counsel a patient on jaundice prevention and management, you first need to reach a mutual understanding. You need to be on the same level with at least the same understanding of the condition, so that whatever you plan or whatever you suggest should be understood. And you set goals for the treatment plan together. So it's hard when you just set goals for the patient. It's hard for them to follow through the goals. So to make sure that the patient follows through the goals, involve them in the setting of the goals, evaluate alternatives, and help the patient choose the best, and also plan the management together with the patient for easy or more compliance.
How can healthcare providers improve jaundice awareness and education?
So they can join community clubs and share their experience or their knowledge on jaundice. They can do public lectures and public talks. They can visit facilities and teach people in those facilities on jaundice and other disease conditions. They can also make sure that each and every patient who presents with jaundice understand the condition and encourage them to share about their condition so that the general public should also get to understand this condition as well.
How do you communicate with patients and families about jaundice?
So, firstly, you help them understand what jaundice is and help them understand how someone can end up with jaundice and why they might have or they might present with those specific symptoms associated with jaundice. Help them understand the management plan and how it is relevant, and help them understand also any complications that might come from the management. Also, encourage them and get them through the recovery process.
What advice would you give to healthcare providers treating jaundice patients?
So I'll start with uh, diagnosis. So this is not specifically for people healthcare providers treating jaundice. So this is for every healthcare provider. So when they are doing their physical exam, they should make sure to make a thorough exam so that they should be able to identify jaundice earlier, even in patients who do not come with typical presentations of jaundice. They should also build a better healthcare provider patient relationship. So, with a good relationship between the provider and the patient, it can increase compliance to the treatment and can also help increase awareness of the condition. And they should also say examples, especially on the lifestyle modifications. So when they are suggesting lifestyle modifications, they should be the first one to follow through those said to be good lifestyle changes. They should be the ones to be shown as examples of what a healthy living person or a person who follows good lifestyles should be.
Alright, thanks for your time.
Thank you.